Increasingly turning to artificial intelligence for health advice as OpenAI launches ChatGPT Health. It raises important questions about safety, trust, and how far technology should go in healthcare. To help us understand it all, we're joined by paediatrician Dr. Linny Fong this morning. Good morning, Dr. Linny.
Hi, how are you?
Now, this is mind-blowing.
Yes.
So are you telling me I'm going to stop using Dr. Google? Not that I would, which always tells me you might be fine or you could be dying tomorrow.
That's true.
So is ChatGPT, tell us about it. How would it work?
Yeah, so ChatGPT Health, when it's going to be launched in Australia, I think there's a waiting list at the moment. But essentially what we know already is that ChatGPT is used increasingly for people asking questions about health. The website essentially says at the moment that 230 million users weekly are asking health-related questions, and
Does that do your head in as a doctor, that you're in your office thinking, please ask me?
Yes and no, yes and no. So the questions that are being asked are around, what is my disease? What do my symptoms mean? How do I interpret some of the medical jargon and terminology that is in my reports? And then I think the worrying part is, back to your question, what actions should I take as a result of what I see in my reports and what the doctor is telling me? And so, we know that Dr. Google often happens in the background anyway. We know that people are looking for reliable sources of information. So in some ways, this is a good thing. ChatGPT Health essentially is being branded as like the partner in health or your health ally. And so what they're saying is that it's going to be a dedicated workspace within ChatGPT, which allows you to load your patient information, reports,
So you could put your blood results.
You can
get
put
blood results.
Correct.
I can put them into ChatGPT.
And it'll tell you something about your health condition. And, I'm hoping, and I think all my colleagues are hoping, that it means that there's some sort of evidence base. And I guess the way that ChatGPT Health are trying to position themselves is that they're providing you kind of personalised information based on what you tell them, and it's giving it to you in a non-medically jargoned way, so that you are able to better understand and interpret your results, so that perhaps you are better informed when you speak to your healthcare professional.
Does this concern you? Of course, technology is already used in health all the time. Is this a step too far?
I think it's a really good question, because at the moment in healthcare we use AI in terms of, AI Scribe, for example. You might go to your GP and you see that they're not typing away at their computer because all of the conversation is kind of happening in the background.
Oh no, hang on. When I'm talking to my doctor, please tell me it's not like writing everything down.
Sometimes, so they will get your permission before they use AI Scribe, but certainly in hospitals as well, we're using clinical decision support tools, so that it means that we aren't having, the same potential biases when we are making diagnoses and interpreting results. But what we know is, in terms of whether or not this is a step too far, I think that, health literacy is a really big issue within community, and I feel that any sort of tool that helps people understand their health better makes for better and more informed conversations. And so maybe if it's used in the right way, and that caveat is really there, if there's something that doesn't make sense, please ask your doctor. But if, people are coming with the right questions before their health consultations, then maybe we as doctors are going to be able to engage them in a better shared decision-making process.
But you don't want people coming in going, this is what I have.
Yes.
And this is what I'd like.
Well, that's right.
That tends to happen, I imagine.
Exactly. And I think people need to understand the limitations of AI and, using something generic to provide you with personalised information. So, a ChatGPT Health or any sort of AI program isn't going to examine you. It's not going to know your entire medical history. It's not going to know your social circumstances. And so there are so many nuanced conversations that happen in the health, consultation, that allow us to decide what the best treatment or management pathway is. And so, ChatGPT Health is not going to do that. And hopefully it doesn't sort of go that way. And I think that clinicians really do need to jump on board in terms of digital healthcare. We need to understand how it works, but patients and consumers need to understand the limitations. And I think we kind of need to work together, because this is modern healthcare. I think this is where it's all heading. Okay,
just hopefully it's not heading to robotic doctors. Dr. Linny Fong, thank you so much for helping us understand and navigate that.
Thanks for having me.
Okay, it's time to